This morning we have the privilege of meeting with Dame Carol Black, who's the National Director for Health and Work. And she's also the Chairman of the Nuffield Trust and is a past President of both the Academy and the Royal College of Physicians. Dame Carol, thank you. Tell me, why and when did you decide to become a doctor?
I decided to become a doctor in my first year as a history undergraduate at the University of Bristol. I went to university to study history thinking it was about people. I found it was about constitutions and rather dull things as I perceived them then. I wanted to do something related to people, and I shared a room with a medic, and I became really interested in medicine and wanted to change subjects.
And when did you decide that you would have to lead rather than follow?
Very early in my career, I became the head of my hall of residence as a history undergraduate, and then I became president of the student union in the year when I did a postgraduate diploma. And so quite early on, when I wanted to change things, I realised in a way I had to get in there and do it.
Were there any people that you considered or saw as role models or mentors?
There were really three people. The first was the headmaster at my grammar school, who really cared about the children. It was a small grammar school, and he really was an inspiration and indeed a mentor. The second person was the warden of the hall of residence I lived in as an undergraduate. She was a really fascinating, interesting woman and really had great faith in my ability to change to medicine and succeed. And the third was Professor Alan Reid, who was the Professor of Medicine in Bristol, who was my professor. I was his houseman. And he was the most remarkably good teacher, and I longed to teach as well as Alan Reid.
Were there any events that you saw that changed your career trajectory, that made you decide and think again about what you were doing?
There weren't any huge events, and I often think in life you get opportunities which you might or might not take. So, for example, I didn't design to become medical director of the Royal Free Hospital, but when someone said to me, well, you've led in rheumatology, you've created a scleroderma unit, you know how to build things, could you consider being medical director of the Royal Free? And I think very often it is the opportunities which you either seize or don't seize that are important, and the things I've regretted, the things I've not tried to do, not the things I've tried.
What makes a good leader rather than a good manager?
I think it's very important that you have energy, enthusiasm, often for change and development and improvement. You need to be hungry, I think, to do things. I think that is terribly important. I think you then need to be very resilient, because I think once you become a leader, you're not always going to be liked. You are going to be criticised. You are going to have to stand the course. And I think resilience is a terribly important thing about leadership. It's always good if you can innovate and if you can inspire. I think inspiration, I ask myself always, would people follow me down this track, or do they want to stay behind?
And what are you doing now?
I've got a really exciting and interesting portfolio now. For the last 3 years, I've been the National Director for Health and Work, which is a cross-government appointment to the Department of Health, the Department of Work and Pensions. And it's been a wonderful job because it's about society. It's about keeping people healthy, well, resilient, and in work. And in the context of the health service, if we look after our staff, I believe we'd have better quality of care for patients and indeed more engagement. Secondly, I've had the privilege of being the chairman of the Nuffield Trust. That is a health policy think tank, and it's been wonderful over the last 3 years seeing that grow and develop and having the privilege to be its chair.
Dame Carol, thank you very much for giving us your time. Thank you.